Hello, everybody. My name is Dr. Konrad Sawicki. I am a second-year cardiology fellow at Northwestern University in Chicago. I'm delighted to be joined today by Dr. Dayna Johnson, who's an assistant professor in the Department of Epidemiology at Emory University, and also Dr. Fink, who's an assistant professor in the Department of Biobehavioral Nursing Science at the University of Illinois in Chicago.
In your practice, how do you see short sleep duration having an effect on the nervous system and on metabolism and inflammatory processes?
That's a great question. We know that lack of sleep increases the risk of all of these diseases like hypertension, coronary artery disease, obesity. And we're just starting to unravel some of the mechanisms that link sleep to disease. Sleep deprivation has been shown to disrupt many of the same biological processes that are altered in cardiovascular disease. For example, cardiovascular disease can be associated with changes in the nervous system. And one of the most important systems for cardiovascular function is the autonomic nervous system. It's responsible for many physiological functions, including the contraction of the heart, the resistance of the blood vessels, and the heart rate. And the autonomic system has two components: the parasympathetic, or rest and digest, and the sympathetic, or fight or flight. Now, we see increased levels of sympathetic activity after partial or total sleep deprivation, which can lead to increases in blood pressure and ultimately hypertension. In people who are sleep deprived, we see increased markers of inflammation, and these levels can remain elevated even after a few days of sleep recovering, suggesting that even just a few nights of restricted sleep can have a long impact on your health. And then this inflammation subsequently causes increased oxidative stress and damage to the blood vessel walls and the release of prothrombotic factors, which can lead to atherosclerosis. And we are now understanding that sleep can regulate white blood cell production and can protect against atherosclerosis, at least in mice. And interestingly, they found that sleep deprivation caused the brain to release low levels of a neuropeptide that then signaled to the bone marrow to cause an increase in the production of white blood cells, particularly neutrophils and monocytes, which ultimately damaged blood vessels and caused atherosclerosis. We're also seeing effects on short sleep on metabolism. In animal models, such as mice and rats that are sleep deprived, we see increased rates of obesity. So our lack of sleep actually causes our organs to secrete hormones that cause us to eat more than we really need. However, it's important to understand that we need more basic science research on sleep. And also something important to note is that studies in mice don't often translate well to humans. So we need more human data as well.